Welcome to session number 6 of veterinary pharmacology. In session number 6, we are going to discuss pharmacotherapy of coccidiosis in cattle, goat, and pig. So we are going to discuss just a single disease, coccidiosis, but in three group of animals: cattle, goat, and pig. Let us begin with the coccidiosis in cattle. So coccidiosis in cattle. Uh, First of all, coccidiosis is a protozoan parasite of cattle. So coccidiosis is a parasite, is a protozoa of cattle, and it is caused by the organism of the family Eimeria, of the genus Eimeria. Uh, and this Eimeria genus group of the microorganisms, there are several species which causes disease in cattle. So in this large group of Eimeria microorganisms, but there are three common species that cause diseases in cattle. And these diseases include Eimeria bovis, Eimeria zweni, and Eimeria albanensis. So these three species are the species which are very commonly causing disease in cattle. And the disease is common in young cattle up to 2 years old. So this is the disease of young cattle. So the calves is a very common disease in calves. It can happen in adult animal, but it's very rare. It's common in young cattle up to 2 years old. And usually is sporadic during the wet season of the year. So it's usually a sporadic disease. Sporadic disease means is a disease that occur at a certain intervals, but these are irregular intervals. It can happen maybe during wet season or time of the year. During wet season, you find the disease is very common. So it is a sporadic disease, and it happens during wet season of the year. So epidemics may happen. So it can be an epidemic, and in most cases, these epidemics have been reported in feedlot cattle during extreme cold weather. So most of the epidemics of coccidiosis occur during cold weather, and is in the feedlot cattle, which are in a confined areas. So these cattle which are confined to feedlot are susceptible to coccidiosis throughout the year. So if the animals are confined, are in one place for a long time, they can be affected by coccidiosis throughout the year, not only during wet season or not only during cold season or cold weather. It can happen throughout the year if the cattle is confined in one place. So cows may contribute to environmental contamination of Eimeria bovis oocyte through pariparturient increase in fecal oocyte count. So pariparturient, what is it pariparturient? Pariparturient is the period of an animal, a young period of an animal, or we can call childish. If it was about human being, we would call it the childish age or the young age of an animal. That period of young age of an animal, that is what we call periparturient time or age. So it is periparturient, the childish age or young age of an animal. So cows during their young age is the time when there is an increased level of fecal oocyte count. So these young cows or young cattle are the one which contain a large amount of oocyte during their periparturient time. So they increase contamination to the environment of this E. bovis. So looking into the life cycle of the coccidiosis in cattle, you will find out that, remember, these are protozoa, so they have sporozoid, merozoid, and also they have oocyte and a sporocyte. So from the feces, the young calves or the cows will uh, defecate the oocyte together with the feces. The oocyte will go into the environment, and under correct climatic conditions such as heat, humidity, and oxygen, the oocyte will sporulate and form infective forms, and these infective forms will be called sporocysts, and this sporocyst will be, it is in the environment, the sporocyst in the environment will be ingested by the animal. So the calf will ingest the sporocyte during feeding, and this sporocyte will release the sporozoite. So in the sporocyst there is a sporozoite. So after eating or after ingesting the sporocyst will release the sporozoite into the gut cells or the cells of the GIT, and in the cells of the gut, then there is formation of merozoite, and then the life cycle goes on. So by this diagram, you know that the microorganism Eimeria can exist both in the cow, GIT, and the environment. So it can be inside the host or it can be in the environment. And also you know that it is by ingestion of the sporocyst. So the transmission or the infection is through ingestion of the sporocyst from the environment. So it is during feeding time, that's when they ingest this sporocyst. So the signs and symptoms of the disease in cattle is watery feces with little or no blood and the shreds of epithelium and the mucus. So watery feces, something like a diarrhea. And also animals may die from secondary bacterial complications or co-occurring infection such as coronavirus infection, and that they can develop symptoms such as fever, become anorectic, depressed, dehydrated, and the loss of weight. And also, if the animal is affected by Eimeria zwini, we say Eimeria zwini is highly pathogenic and they cause blood diarrhea. So you can see normal watery diarrhea in other infections of Eimeria, but if the animal is affected by Eimeria zwini, you'll find out the pathogens will cause bloody diarrhea. So it will be blood diarrhea. So from this second point is that the animal may die from secondary bacterial complications. So remember, this coccidiosis is not a bacteria, it's a protozoa. But by affecting the GIT and by affecting the animal, and if the animal after the effect of protozoa then gets another disease, gets another infection, it can be a bacterial infection or it can be a viral infection such as coronavirus infection of the cow, then this secondary infection will cause the animal to die, and it can develop symptoms such as fever, anorexia, depression, dehydration, and also loss of weight or unthriftiness. The animal will lose the body mass. How can we treat coccidiosis in cattle? By using amprolium or sulfamethazine or dicoquinate. So you can use these drugs to treat coccidiosis in cattle. So remember to know the dose of each of these drugs and the duration or the whole time period of that particular dose. Make sure that you know each and every dose of these drugs. Monensin can be used and also can use supportive therapy. So remember, there is diarrhea in this disease, either bloody diarrhea if it involves Eimeria zwini, or it can be watery disease or watery diarrhea, sorry, if it involves other forms of Eimeria. So if it involves diarrhea, there is loss of fluids. So you can use the supportive therapy, which is animal fluids. You can provide fluids as a supportive therapy. But remember, when you use monensin, do not mix monensin with other drugs that have similar action as monensin. And also do not treat the animal with thiamulin for at least 7 days after using monensin for treatment. And also avoid direct contact with the skin or wash thoroughly after handling the product. So if you handle this monensin by applying it to the animal, make sure that you wash your hands and make sure that you do not allow direct contact of your skin with the drug monensin. Okay, contraindication of these drugs: sulfamethazine can cause allergy and hypersensitivity, and also dicoquinate can cause hypersensitivity, and monensin also can cause allergic reaction. And common side effects of monensin: it can result in reduced weight, it can reduce voluntary feed intake, it can reduce milk fat percentage. So in the milk of an animal, there is percentage of fat. So if you use monensin, you reduce that fat percentage in the milk. Increased incidence and treatment of cystic ovaries and metritis. So it can increase some incidence in the issues of cystic ovaries and metritis. And also reduced conception rates. So animal may not get conception during treatment with monensin because monensin reduces their conception rate. Prophylaxis: you can use amprolium and monensin as prophylaxis. So monensin can be used for treatment, but also it can be used for treatment. The same applied to amprolium. It can be used for treatment, and also it can be used as a prophylaxis treatment. And the control of the disease: make sure that you increase ventilation at the place where the animals are living, and also housing. Uh, Housing should be placed in such a way that you allow good hygiene and also good ventilation in that particular area. Do not mix different ages of calves. So remember, we said calves uh, are the source of the disease. So do not mix different age groups. This disease is common to cattle, to young calves up to 2 years of age. So do not mix calves of different ages. There could be cross contamination. And also you can isolate the affected animal in order to prevent contamination of the premise. So isolate, take away those affected animals. So that is coccidiosis in cattle, but also there is coccidiosis in goat. Coccidiosis in goat is an acute invasion, and it can destroy intestinal mucosa by protozoa. The protozoa which are involved in goat is Eimeria and also Isospora. So these two can cause diseases or can cause coccidiosis in goats. Uh, Goats and the lambs are the same. Uh, in the lambs, also, it is 1 to 6 months old are the one which are affected by the disease, and it affects them in the lambing pains or in the areas where the lambs are living or the areas where the lambs are released to live there. Also, intensive grazing area, the areas where they eat and walk around. Feedlots at greater risk is that of shipping. If you are transporting these animals from one place to another, ration changes. If you are changing foods, you can cross-contaminate the animals. Crowding stress. If you put a large amount of animals in a certain place, in the same place, you can increase chances of coccidiosis. And also severe weather. If the weather condition is not well, it can cause coccidiosis, and also contamination of the environment with oocyte from ewes and other lambs. So sometimes the ewes or the lambs which are in a childbearing age, or they are in the female part of the female lambs, they can be a source of contamination with oocyte. So in goats and the lambs, the female goats or the female lambs, they can be source of contamination with oocyte. Signs and symptoms include diarrhea, fever, inaptitude, weight loss, and emaciation. Emaciation means losing a large amount of body mass or becoming thin or being thin. That is emaciation. Wanakonda sana. That's the meaning of emaciation, uh, which is associated with weight loss, inaptitude, fever, and diarrhea. And pharmacological treatment is by using sulfaquinoxaline, which is put in the drinking water for 3 to 5 days. Side effects is crystallization in the urinary tract. Side effect of the drug can cause crystallization in the urine of urinary tract, and also hypersensitivity and anaphylaxis. Contraindication: intrauterine administration. So it is contraindicated when there is intrauterine devices or intrauterine administration. Do not use it. And also can use monensin as a prophylaxis for lambs and the goats. You can use monensin. Also, there is coccidiosis in pigs. Pigs also get coccidiosis, and there are 8 species of Eimeria and one of Isospora, which are responsible for infecting pigs. Isospora suis is prevalent in neonatal pigs. So if the coccidiosis in pigs is caused by Isospora and it involves Isospora suis, then the disease will be very common in neonatal pigs or young pigs. Signs and symptoms also, it is associated with diarrhea, and the diarrhea becomes watery and usually with yellowish or white in color, and also foul smelling. So it is highly smelling foul. Piglets may appear weak. The young pigs can appear weak, dehydrated, and also depressed. Those are the signs and symptoms of the coccidiosis in pigs. You can use sulfamethoxine for treatment, and you mix it in drinking water in every 24 hours for 2 to 4 days. And amprolium can be used also. You can put it in drinking water. And the side effects of these drugs include cutaneous eruption. There will be growth and overgrowth around the skin or over the skin. There is an overgrowth on the skin, and also hypothyroidism. Hypothyroidism can be side effect of these drugs. Prevention and control. In the premix, when you are mixing, you can mix the drug dicoquinate in the feed or in the food that the animal is going to eat, or 200 milligram per kilogram in the feed throughout the risk period. So you use dicoquinate as a preventive therapy, and you mix it, you pre-mix it with feed. So if the food has to be eaten once, you use 60 grams per kilogram. If you want it to be eaten all over the period of the time or in a given period of time, you use 200 milligrams in the overall feed that is going to be eaten at a certain period of time. Removal of the feces and disinfection of farrowing facility is very important. Between the liters, greatly decrease infection. So farrowing facility, those areas where the pigs are put there so that they can give birth to their piglets. Farrowing ni maeneo ya mazalia, sehemu ambazo nguruwe wanawekwa kwa ajili ya kuzaa, zinaitwa farrowing facility. So those farrowing facility, then the removal of feces is very important, and the disinfection in order to remove the infection of coccidiosis. So that's it. And these are the key points which you need to read and put it in mind and this particular session of coccidiosis, and also ask these questions in your own time, so that make sure that you can answer all of them. The meaning, the common signs and symptoms, or the definition of coccidiosis, common signs and symptoms, the pharmacological treatment, and the control measures. Very important you learn these questions. Thank you very much. Welcome for questions.